Hey folks, Doc C here. I just wanted to talk about something. It's pretty important. I hear this all the time from a lot of different patients, and it seems to be a real, how would you call it, epidemic going on. And I'm going to read off a few things, and if the majority of these things that I talk about apply to you, you may want to be able to maybe change a few things, okay? So, one of the things is, do you have a low sex drive? Number two, problem if you're a guy having a problem having an erection, low sperm count, trouble sleeping, insomnia, dealing with stress, that type of thing, decrease in muscle size and strength, bone density loss. Usually that you have to be told by an MD, but in some cases, if you get an X-ray and that person states with that he sees a lack of bone density, that's pretty substantial if it's on an X-ray, because you have to have lost usually 20 to 25% before you see it on an X-ray. Also, an increase in body fat. Sometimes it comes on little by little. Also, depression. Now that's linked to stress as well. Now, if you suffer from some of these things, chances are you got a low testosterone count. Now, it would be a great idea for you to be able to be objective with that and to be able to go to your MD, explain your situation, and if these things apply to you, you may want to let them know that you'd like to get a blood test on your testosterone, because it's really important. Testosterone is very, very important. When we're young, when we're 19, we have growth hormone, we have testosterone coming out our ears. We don't have to worry about working out as much as we do now. But like I just said to someone, if you're in your middle ages, your 40s or 50s, and you're not working out to maintain the stomach strength, your low back needs to be stabilized, and your stomach, your core muscles need to be strengthened. And if you're low on your testosterone, you're going to have to work out, because your testosterone is usually what helps maintain that muscle mass. And if you're going down in testosterone, you have to make up for that by working out more and strengthening that area. Do you see what I mean? If you either use it or lose it, right? When it comes to this subject, you either use it or you lose it, because it won't just do it all by itself for you. Like when you were 19, it did it all for you. Not anymore. So we have to be able to be on top of that to maintain spinal health, maintain a good, a good relationship. When you think of all the things you can do to fight low testosterone, there's a number of things that you can pull out of your bag, so to speak. Some good ammo. Now, one of the things you want to be able to do is look at exercising, getting back into the exercise, like I just said, because some exercises that really are good at actually sparking a little bit of testosterone in the body. Things like squats, overall body exercises, when you're actually doing that type of thing, where you're having to exert. That's probably why some of the people who work in the agriculture industry back in the day, when they're throwing bales and things like that, they probably maintained a little bit more of their muscle mass when they did that, and their, the body in general. Things like adding herbs. Tongod Ali is a really, really good one. I was listening to a physiologist talk about this, and they tested animals, and they found that Tongod Ali and Phaedogio agrestis are pretty good at actually helping to bring up the testosterone. It's not as good as hormone replacement therapy, but naturally it's a great thing to use with these other things. You want to add these things together. Also, having some type of vasodilator, because those hormones, you want them to get to the right places. So making sure the blood vessels are open properly, and that that you have access to it. So making sure that you're getting spinal adjustments by a chiropractor, making sure that those nerves are opening up those blood vessels, plus things like citrulline. It's an amino acid. It's a precursor to arginine. Arginine and citrulline work very well to actually help open up the blood vessels. Something else you may like is black ginger. A lot of those things will work for you. They'd be able to open those things up, helps with an erection, things like that. Before you do it, like I say, maybe get checked out so you have a baseline, you have something to work from. If you go to an MD and you say, I'd like to have a blood test to know where my testosterone is because I feel like I might be low, I'm sure they're willing to work with you, because I find that it's a sort of a hidden disease. It's like a hidden disease. When you're low, it really affects so many things in your life. It's unbelievable how many things low testosterone affects. like I say, talk to them and let them know that you'd like to do something like a 4 to 6 month trial of therapy. And when you do this trial of therapy, naturally, if you're doing natural things, try to cycle your hormone. If you're going to use herbs, do a cycling where you go 3 weeks on, 1 week off. Because what'll happen is your body has a tendency to become used to things. Like it'll get so it won't be as so sensitive to the herbs. But if you go 3 weeks on, 1 week off, when you come back on, your body will pick it up and run with it better. It's a much greater chance. Also, well, I guess after if you've tried these things and they haven't been effective, and you have your second test after 4 to 6 months, there's always the option of talking about testosterone replacement therapy. It is a little expensive, but it can be very, very helpful. I have a number of patients who have told me of the positive effects of testosterone replacement. So if you like what we say, please tell others, and hit the like button. If you want to hear more, please hit the subscribe button. Remember, Santa says, have a great one. Take care.